Welcome back, everybody. Well, those sometimes embarrassing bumps on your skin that can be aggravating to get rid of, they're called warts. What causes them, and with some advice on how to take care of them, is Dr. Fred Nagel with Baptist Health Family Clinic in Maumelle. Good to see you.
Good to see you, Melinda.
Yeah, sometimes we don't like talking about warts, but we need to because they are actually quite common, right?
Yeah, not very popular, but common.
Yeah, what are they?
Well, they're a growth on the skin, and the answer to the question is they're not caused by frogs. They are caused by a virus, a particular one called human papillomavirus, or HPV. And what the virus does is gain access to the skin through a small crack in the skin or laceration, and then it stimulates that outer surface of the skin to really grow rapidly, and then that forms a wart.
I think we've got some pictures to show you if you're just not sure about how they look. Some of them can be quite ugly.
Well, this is part of the diagnosis of a wart, and usually that's done just by appearance. And this is a typical common wart that you have on the finger. You can see that it's raised, kind of cracked appearance. And those little black dots there that people call seeds are actually not seeds at all. They're just coagulated blood that is clotted in the small capillaries that supply the blood supply for the wart. And then the next picture is of a plantar wart, and that looks differently. It almost looks like a callus that you can see on the foot, and it may be mistaken for that. But those can be painful when you walk on them or put pressure on them.
And how are they diagnosed? Just by kind of looking at it?
Well, you look at them, but that can be tricky because warts look differently on different parts of the body. So you have different types. We saw the two examples there, but you can also have villiform warts, which appear on the face. They have little finger-like projections that stick out. You can have flat warts, and you can have periungual warts that occur around the fingernails. And one other wart that I would like to just include is a sexually transmitted disease called condyloma, and that is transmitted through sexual contact and has kind of a cauliflower type appearance. But if you're unsure of the diagnosis, your doctor can always get a tissue sample, do a biopsy, and confirm the diagnosis that way.
And how are they spread? Can we spread them to other people?
They're usually spread through direct contact. The wart could be spread through sharing a towel or a razor or some other personal device that you might have. You can also reinfect yourself. If you touch a wart that you might have to an open part of your skin, you can transmit the wart that way. But we're not always all susceptible in the same way to warts. Some people get them more than others. That probably has something to do with our immune system. And for some reason, young children and young adults tend to get them more than other age groups.
Than older folks. Okay, you've got some ways to treat them. And I've heard the duct tape thing. And first I thought that was a joke, but it's not, right?
Well, it actually does work. We talked about that one other time. But the problem with the duct tape is you have to keep it in place for such a long period of time, for several days in a row, and it just becomes impractical.
Right, so one of these would work better.
But with all the home remedies out there, there's probably as many treatments as there are warts. And I would also add that warts don't always need to be treated. A lot of times they will just go away over time. But if they're painful, spreading, or unsightly, you may want to treat them. And these are some examples here. This is some over-the-counter products. This is a salicylic acid that you can apply topically in the form of compound W that might be of help. This is a topical freezing applicator. And if those don't work, then you can go to the doctor's office and have them frozen there. This is what I use in my office. It's a canister that we use liquid nitrogen and actually spray the wart to freeze it. And they can also be injected or even surgically removed. But I would add that by removing the wart, they can still recur. And the reason is that you don't always remove the virus that causes the wart.
Very good. All right. Well, more information is available for you at the Baptist Health Line at 1-888-BAPTIST. Whether your question is specifically warts or something else going on, then give them a call. And we thank you, Dr. Nagel, for coming in. We appreciate it. Now we know a whole lot more about them. All right.